Shortly after the Health Minister briefed journalists in Abuja, the Lagos State Ministry of Health, in conjunction with officials from the federal government and World Health Organization, also held a separate media briefing in Lagos, where the new case was confirmed.
As at today, one patient has tested positive for the disease out of the 8 under our clinical surveillance and care. The state has established isolation and treatment center to hospitalize these patients. The staff at the isolation and treatment center have also received training in infection control procedures for Ebola. The hospital is also equipped with materials to ensure protection of the healthcare staff and other patient populations in these facilities. I must say that the patients under our surveillance are all persons who had personal contact with the initial patient that came from Liberia. And the rapid response team had been in communication with these patients who developed fever and other symptoms. We are just, well, like we just said last time, it's a continuous tracking. We're continuously tracking them. The contacts remain in isolation until confirmatory test results are in. And those of them who test positive for Ebola will remain in isolation until they are no longer infectious. The occurrences of secondary cases was expected given the nature of contact these persons had with the patient from Liberia. This was because they were unaware of this status until the management of the hospital reported their suspicions to the state government. The investigation team is in communication with family members and other contacts of the new suspect cases to counsel them and monitor their health status. Given the complexity of the outbreak in the West African sub-region and the current situation in Lagos, the ministry is taking all precautions to contain the spread of this disease.